Imagine waking up with fatigue so intense, it feels like your body has given up. Your joints ache, your head throbs, and your memory is a fog. You start to wonder, what's happening to me? This isn't a horror story. It's the everyday reality for thousands suffering from a condition many doctors still overlook: Lyme disease. What started as a simple tick bite turns into a life-altering illness for millions around the world. But here's the catch: most people don't even realize they've been bitten. So, what is Lyme disease? Lyme disease is caused by a spiral-shaped bacterium called Borrelia burgdorferi, transmitted to humans through the bite of infected black-legged ticks, often called deer ticks. These tiny parasites, no larger than a sesame seed, can deliver a powerful blow to your immune system. In the early stages, symptoms mimic the flu: fever, chills, headache, fatigue, muscle and joint aches. A hallmark sign is the bullseye-shaped rash, but not everyone gets it. Left untreated, Lyme disease can attack the nervous system, joints, heart, and brain. It becomes chronic. People can lose their ability to walk, speak clearly, or concentrate. Some even develop symptoms that mimic multiple sclerosis or fibromyalgia. Here's where things get scary. Diagnosis is not straightforward. The standard tests often miss early infections. False negatives are common. Patients are told it's stress, or worse, it's all in your head. And this isn't just a rural issue. Urban parks, suburban backyards, and even beaches now report tick populations due to rising temperatures and changing ecosystems. Lyme disease is expanding fast. So who's at risk? Anyone who spends time outdoors: campers, hikers, children playing in grass, even gardeners. But due to poor awareness, it's often dismissed until it's too late. Treatment usually involves antibiotics, doxycycline or amoxicillin. If caught early, recovery can be swift. But for many, symptoms linger. Chronic Lyme, or post-treatment Lyme disease syndrome, leaves people fighting fatigue, cognitive dysfunction, and pain for years. Let's talk numbers. Each year, over 476,000 Americans are diagnosed and treated for Lyme. But experts believe the real number is far higher. Cases in Canada and Europe are also on the rise. In the UK, there's been a dramatic increase in tick-borne illness reports. Australia has reported cases with similar symptoms, sparking debates on local transmission. But here's what many don't realise. Ticks are active not just in summer. As winters become milder, tick season is stretching longer. They can latch onto pets, clothing, or even hide in your car. So what can you do to protect yourself? Wear long sleeves and tuck pants into socks when in grassy areas. Use tick repellents with DEET or permethrin-treated clothing. Do full-body tick checks after being outdoors, especially behind the knees, underarms, scalp, and waistband areas. Shower soon after coming indoors. Be vigilant with pets too. They can bring ticks into your home. And if you find a tick, remove it promptly using fine-tipped tweezers. Grasp it close to the skin and pull steadily without twisting. Clean the area thoroughly and monitor symptoms closely for 30 days. There's also a growing call for vaccines. Pfizer is in late-stage trials for a Lyme vaccine targeting the US and European markets. But until that becomes public, awareness is our best defense. Now, let's address the elephant in the room. Why is Lyme disease still so misunderstood? The short answer: lack of consistent research, awareness, and funding. Advocacy groups argue that chronic Lyme patients are gaslighted and dismissed by mainstream medicine. Many have turned to alternative treatments, some helpful, others dangerous. So where does that leave us? It's time to treat Lyme disease as the serious epidemic it truly is. Early diagnosis saves lives. Education protects families. And awareness brings change. You might not hear about Lyme disease on the evening news, but its effects ripple silently through schools, workplaces, and communities every day. So now that you know the truth, what will you do with it? Stay informed, stay protected, and share this with someone who needs to hear it.